This is Andy with NMS Imaging. Today we're going to show you our electronic patient medical record system. It's a web-based HIPAA compliant document management system for all those paper files that you have in patient records that are not being handled by your EMR system. When we do integrate with EMR, you're always going to have that paper floating around that you want to capture, make sure it's backed up, make sure that physicians and staff have quick, immediate, secure access to. We'll start out doing a quick search to show you what it's like retrieving a patient file. You just start typing in the name, you pick the patient, up comes the record. Shows you the date of service and some of the details about the patient. If it doesn't have anything into it, it says the patient doesn't contain files. I'll show you how to put those in a second. So you do another retrieval. Up here, all you got to do is replace the one you have. You start typing the name, it shows you the drop down, you click on it, and for each time there's been service rendered, it's going to show you another patient record. Here we have another one, shows you a line, click on it. So let's pull up one here that has a lot of records. So here we have a bunch of dates of service. We figure out what date of service we're looking for. Scroll down, and we come over to the view button. We'll click on that. Loads the entire patient file for that date of service. So now all I have to do is flip through it, find the page or the details they want, print it out, give it to the physician, send it to billing, whatever you need to do with it. The way that the documents get in and indexed is critically important in this because we know that you have limited staff time, you don't want to do a lot of indexing, you don't want to make any mistakes. So all you do is you pick the date that the files were collected, you pick the patient you want to attach it to, and then you pick the date of service that the file belongs to. You click on it. Click File Document, you're done. No typing, no indexing, no mistakes. We'll pick another day. Up comes the document, we review it, figure out what patient it belongs to, click on the first letter of the last name, click on the date of service, click on File Document. You can see how this is going to be extremely fast for the people that you put in charge. It brings up the next document right away, if there is one, and then you do the same thing. You can also type up here if you'd like. Gives you selection. And here we have one that has no date of service, so we don't know what date this belongs to, so you can go in, and I'll clear this error here, we can go in and add a date of service and then attach the document. Okay, so we add new service, we put in what date did it occur, and this is readily available on the document. You click File Document. You're done. And that's the worst case scenario right there. So 0 documents left in your inbox, and you're good to go. Pull up the last one here. Pick a patient. How about Mr. Gibbs? File the document. You're done. So we've eliminated all the data entry, all the errors, and given the user some options about how they want to see the documents, newest document first, newest document last. We also have an audit log. For admin or security users, you can go in, you can see what user did what, when did they do it, how did they index it. Nothing will get lost in the system. No one will have unauthorized access. And we can export this to a CSV file that you can use in Excel or your database if you wanted to run some reports. Here in the patient's administration, you can do things like add new patients, add new dates of service, modify patient data, and this is just for the retrieval of these documents. Very simple, straightforward user interface. Here we see multiple service dates on the right. We could add a new one if we'd like. We can even add a new patient from here. We can delete the patient if we need to. And then here we have security where we can modify the user's roles, their email address, make changes. So that's a quick and dirty demo. It shows you the main features, how easy it is to use, no capital investment required. It's a per file pricing. You can set yourself up with a small scanner or you can use your multifunction devices. Kodak has a excellent device that sits on the desktop, network attached scanner like you see here. Just drop it in, scan it directly to the system, and you're good to go. Again, Andy with NMS Imaging.